Okay, Melissa, so let me know some of the symptoms you've been having.
My scalp has been itchy and numb recently. There's
Okay.
some tingling,
Okay. Is there any specific part of the scalp that is itching and numb more than others, or is it all around?
particularly the top portion, more on my bangs and the frame of my face.
Okay. I'll definitely be looking along your hairline to see what's going on. I'm going to be looking for redness, making sure that you're not having any neurological problems. So I'll be doing some sensory tests where I ask you questions, whether you feel something a certain way or not on your scalp, okay? But just for now, relax. I'm going to make a part in your hair and do some examinations with a magnifying light, okay? Okay. Just on first inspection, your scalp looks very clean. I'm seeing a little bit of redness here and some uneven patches. Possible flaking. Just gonna bring this up here a little bit more. Okay. Okay. I'm going to take a look with this light. This helps me visualize the hair follicles and the pores along the scalp. So I'm seeing some red patches for sure. So this could be allergic reaction. Have you switched any hair products lately? Any new shampoos, conditioners?
Yes, I actually did recently switch to a new care line, so that probably is it.
Okay. And how long have you been using that product?
Just about a month now.
Okay. How long has the itching been going on and the tingling?
I would say the last week or so, and it honestly comes and goes.
Okay. I'm going to be pressing lightly just along the hairline. Will you let me know how many times you feel the tapping? Once, twice, or 3 times? Or not at all?
Once, twice, 3 times.
Good. Okay. Okay. And now you're going to feel a puff of air on your scalp. Let me know if you feel it once, twice, or 3 times.
Once, 3 times. Once. Twice.
Okay. Very good. Okay. I'm not seeing any lice. Not seeing any bugs, so I don't think you have any kind of fleas or infestations. Definitely going around this season, but it looks to be clear. Just going to take a closer look to be sure. Your skin is very well perfused.
Thank you.
So I'm going to be applying just a serum that's going to help oxidize the dermis and open up your pores just so you're a little bit more receptive to sensory tests. Okay. Should feel cool to the touch. I'm going to take a sample to send to our lab for testing. Okay, and is that itchy or painful at all when I press here?
No.
Okay, how about when I press here?
No.
Okay. Okay. I just try with a wooden comb to see, better visualize the hair. Okay. Your hair seems to be healthy. I'm just ruling out any kind of infection in the hair.
That's great.
Okay, and I'm just going to palpate your head, okay? I'm just feeling for any lumps or bumps. Make sure that there's no protrusions, swelling, or edema. Okay, everything feels normal. Okay, I'm going to place this object right beneath your ear. Let me know if it feels cool or normal or just neutral.
Cool.
Okay.
Cool.
Right here.
Cool.
Okay. And here.
Cool.
All right, and what about here?
Cool.
Okay. Here.
Cool.
Okay.
Cool. Cool. Cool.
Okay. Okay, just separating strands of hair. Okay, so I'm going to turn around and have you face the wall, and then I'm going to just do a more in-depth inspection of your part, okay?
Okay.
Okay, so next I'm going to do a sharp and dull test. This is going to be a sharp sensation, and this will be dull. Do you feel the difference between those two?
Yes.
Okay, go ahead and say sharp or dull.
Sharp. Dull. 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 Sharp. Sharp. Dull. Sharp. Dull.
Okay.
Dull. 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 Sharp. Sharp. Dull. Dull. Sharp. Sharp.
Okay, so you got some of those wrong, which could be the sign of neurological issues going on. I'm going to just run a few more tests, okay, just to be sure.
Some I was not too sure on.
Yeah, it's good to just do your very best, and then sometimes the sensations can feel similar, so you got most of them right. I just need to see if you can differentiate between different textures. Okay, so this is going to be a wet sensation. This will be dry. Do you feel the difference?
Yes.
Okay, go ahead and say wet or dry.
Wet. Dry. Dry. Wet. Wet. Dry. 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 Dry.
Okay.
Wet.
some numbness near the crown of the scalp. Definitely, I can see that. Seeing some redness too. Let's keep going.
Wet.
Okay.
Dry.
Okay.
Dry. Wet. Dry. Dry. Dry.
Okay. We'll keep going.
Wet. Dry. Dry. Wet. 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 Dry. Dry. Wet. Dry. Wet. Dry. Dry. Dry.
Okay. Just using a baseline of your shoulders to see if you respond a little bit better.
Dry.
Okay.
Wet. Wet. Wet.
Good.
Dry. 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 Wet. Wet.
Okay.
Wet.
Good. Next is going to be a warm or cold sensation. Okay, so I have a sensory globe. That's going to be cold. And I'm going to use my finger to be a warm sensation. Do you kind of feel the difference?
Yes.
Okay.
Cool. Warm. Cool. Cool. Warm. Cool. Cool. Warm. Warm. Cool. Cool. Warm. 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 Cool. Cool.
Okay. Next, you're going to feel pressure or vibration. This feels like a pressure. Is that correct? All right. Can you feel this vibration?
Yes.
Okay. Is this a vibration or a pressure?
Vibration.
Good. And then what about this right here?
Pressure.
Good. Is this a pressure or vibration?
Vibration.
Good.
Vibration. Pressure. Vibration. Vibration. Pressure. 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 Vibration. Vibration. Vibration.
Good. Okay. I'm going to take a look with my pen and just assess some of the areas of redness And I'll measure the spots just to have for records. Okay. Now as I bring my pen all the way from the center of your scalp to your ear, do you feel it all the way?
Almost.
Okay, was there an area that was more numb?
No.
No? Okay. As I bring it back, do you feel it all the way?
Yes.
Okay, good. Measure a couple regions of redness I see, a couple flakes here, but they're not dandruff. This is 0.2 millimeters. Okay. And then this region is about 1.5 millimeters. Okay. Do you spend a lot of time in the sun?
I do.
Okay, I see that you have a lot of natural freckles. Beautiful.
Thank you.
But it's important to just remember to use SPF on top of the head too. There are certain sprays you can use for the scalp, especially because you're having these issues with itching. Even if it doesn't come from sun exposure, the sun can exacerbate pre-existing scalp conditions. So just keep that in mind as we go along. Okay. This is 3 millimeters, a little bit larger of a red patch here. Okay. And just to gauge of reference, the half circumference of the scalp or quarter is 6 inches. Okay. A couple more sections here. It's normal. It's about 1.5 millimeters. All the redness I'm seeing is normal as of now. I'm not seeing any enlarged areas that are problematic. So just because of some of the inconsistencies with your sensory tests so far, I'm leaning towards perhaps a neurological issue. But that would require further testing, and I'm going to keep assessing as we go. Here we have, this is 3 millimeters, okay? And on top of the scalp, 2.5 millimeters, and it's symmetric. I'm not seeing any molding to keep track of. Okay. Just want to make sure the scalp is flush with the skin. As I bring this wooden stick all the way down, do you feel it all the way? Are there points of numbness?
I feel it all the way.
Okay. Gonna look at the other side. I'll take this off. This is getting in the way. Just making sure that everything's flush with the skin, that the hair isn't showing signs of indicating that the head is swelling. Okay. Normal sounds. Okay. And I'm going to bring it from the bottom of your neck to the top. Let me know if you feel that all the way as well.
Yes.
Okay.
Yes.
Okay.
Yes.
Okay, very good. Just sectioning the hair. Okay, we're going to do sharp or dull again. Let me know if you feel sharp or dull on this hairline here.
Dull. Sharp. Sharp. Dull. 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 Sharp. 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 Dull. Sharp. Sharp. Dull. Sharp. Dull.
Okay, a few more.
Sharp. Sharp. Dull. Sharp.
Okay, next we're going to do warm or cold.
Warm. Cold. Warm. Cold. Warm.
Okay.
Warm. Cold. Cold. Warm. Warm. Cold. Cold. Cold.
Okay. Measuring some sections here. 1 millimeter. It's a larger freckle. With your permission, just to loosen up some of the dendrites of the scalp, I like to perform some hair pulling therapy, very gently taking strands of hair and tugging. It should not feel painful at all. If it does, let me know, but it should feel kind of like a release of pressure. Okay, does that sound
Okay.
good to you? All right.
Yes.
Okay. 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 And this helps to promote circulation throughout the scalp. If there are areas of tension or blockages in blood vessels, then hair pulling can help just reactivate those follicles. Very gently tugging, not much pressure, but should feel like a massage. Okay, I'm going to do a few on the other side. Okay. 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 Okay, Melissa, that ends our treatment for today. I'm going to order some neurological tests, some imaging done, just to rule out any neurological issues. What I see is perhaps just some irritation from some product that you've been using. So I would just take a break from the Curlsmith to see if maybe the itching improves. Also, take a look at your pillowcase and things that you put on your head every day. Maybe it's time to try a different shampoo. And I'm going to get those imaging tests done. I'll order them for you within the next week. And then we're going to reassess after we get all those results, okay?
Wonderful. Thank you so much, doctor.
Sure. I hope the hair pulling therapy provided some relief for you for now.
Yes.
Okay. Great. Well, we'll see you next time, okay?
Thank you.
All right.